Hello, my name is Dr. Anna Benson. I'm the Joint Clinical Lead for Mental Health for Herts Valley CCG, and I'd like to talk to you today about NHS checks that will be coming into practice very shortly. We're expected to complete these checks in our surgeries for patients with severe mental illness, for example those with schizophrenia, bipolar affective disorder and the like. So this is a real must-do for GPs. We're all trying to get the physical health checks done, and these will be due by March 2020. The target is 60%. But when you think how important these checks are for this vulnerable population and the difference that you could potentially make over the long term, I think it's truly worth it. Patients with severe mental illness are likely to die 15 to 20 years sooner than the average population. This is often as a result of lifestyle as well as medication complications. This group of patients are 3 times as likely to smoke. They have double the risk of obesity and diabetes. They're 3 times as likely to have hypertension, and they are 5 times as likely to have dyslipidemia. It's vitally important that as well as managing their medications and their mental illness, we consider their physical illness and the impact that this will have on their life expectancy as well as the quality of life. As GPs, it's our responsibility to build up a rapport for this vulnerable group of patients, to highlight any changes in lifestyle or habit that we can support patients with SMI in order to improve their life expectancy. The screening check that NHS England have asked us to undertake will be done in conjunction with secondary care. We'll do it in our practices on a simple template that's easy to fill in, considering the patient as an individual and how and where we can intervene in order to help with smoking cessation advice, obesity management and diabetes prevention. But we must do it thoroughly, not just tick the boxes, but actually try and make a difference in terms of the outcomes. There will be some gaps in training amongst our clinicians, and we'll be there to support and to help come into practices. We'll also be able to supply a GP information pack. Obviously it's quite hard to engage with this group of patients. They find it difficult sometimes to get to the surgery or scary, and the more information or preparation they can have before the checks, the better. It depends on the way you work. You might want to invite your patients in to an afternoon's clinic where one clinician does each SMI check back to back, or you might wish to invite patients into individual appointments to suit them and to suit the people coming with them, in which case the majority of your clinicians will need to know which template to fill in and how to answer the questions. If you need any more further information, don't hesitate to get in touch. Together with secondary care, I'm sure that we can fill in these quite simple questionnaires and really make a difference to the outcome for people with SMI.